once you schedule in those non-negotiables to ensure that your loved ones are taken care of and yourself is taken care of, then the work and the productive tasks will go around that instead, not the other way around.
Hello, everyone. Welcome back to the channel. I am so honored to have with us today Dr. Tsung. Dr. Tsung is an ER and critical care physician and also an aerospace physician. So I'm delighted to hear more about her story and specifically talk about something she's really been passionate about, which is productivity. And if people know me, we don't talk about busy productivity, but productivity that's in alignment with your why. So, Anne, thank you so much for joining me today.
Yeah, thank you, Jillian, for having me. I know we connected through a mutual friend and just found like we had a lot in common in terms of productivity and productivity to be busy versus productivity, when it actually aligns with your values, like you said. So let's go ahead and dig in.
Yeah, absolutely. And I know some of the things that you mentioned and that I had the opportunity to listen were on your podcast, and I got a glimpse of what you do as a coach. So I'd love to share with the audience. Can you tell them a little bit more about your podcast?
Yeah, absolutely. So, the podcast, it's called It's Not Rocket Science Show, and it's it's focused on productivity, but also maximal health and also creating deep relationships. And the reason why it's called It's Not Rocket Science Show, it's because my primary job is a NASA flight surgeon. So I played into that theme. And also I want to say that it's really back to the basics in order to create the ideal life that you want around you. And then I do a part-time job as, yes, the productivity coaching, and then also podcast show host and real estate investing and work in the ICU and ER part-time.
And I think this is amazing. Like I was mentioning to you a little earlier, is like you're the ideal person to have, we sometimes get some narrow focus in medicine, and you've just been able to really expand your horizons. How did you even kind of consider going into the aerospace medicine?
Yeah, I think when I was little, I've always wanted to contribute to space, no matter what field I went into, because I moved to Houston from Taiwan and we visited the Space Center Houston. So I was already intrigued. Later, when I was at Borders bookstore studying as a third year medical student, I didn't want to study anymore. And I Googled space doctor, and that led me down this path, knowing like there's a short course or elective rotation for a fourth year medical student in aerospace medicine at University of Texas in Galveston, and then also a NASA research clerkship. So I applied for both and did both, met a lot of mentors, connections. And then so I said, I'm going to go into ER. And then I didn't feel like ER was enough in terms of, knowing what goes on upstairs. So I went to a critical care fellowship, but always after whatever training, I was going to go back and do the aerospace medicine fellowship of 2 years, which includes a master in public health. And that's exactly what I did from 2018 to 2020 after my husband and I took our first mini retirement and traveled the world for 8 months.
Wow. And your productivity really resonates with me because of what you talk about. So, can you share with people your focus when it comes to actually talking about productivity?
First thing on productivity is ensuring that they're going towards your values and your whys. And maybe the first step I always usually, have people do is to imagine the life that you're living when you're, 85, 90 years old. Who are you surrounding yourselves with? How many kids do you have? Do you have no kids, grandkids? What are you contributing to? What sort of funding are you providing to whatever study, maybe research, et cetera? Like hunger, any research? What businesses do you have? What real estate investments? How much residual or passive income do you have? And what kind of fun are you having? How is your relationship with your spouse or your pets, et cetera, whatever. And then we like come back to 1 year and focus on the only five goals for the year. And then we take a look at every day or every week, whatever you're doing. Is it going towards your ideal vision when you're 85, 90, or is it going away from it, or is it not doing anything at all? So I think that's like the very, very gist of it in just like a minute.
That's lovely. In my coaching training, we have this tool called the ideal day. So often when people are very lost and like, I was following societal pressures for so long, I have no idea what I want. then we really step back and say, well, what is your ideal day? Like, even if it's more in a proximal, but it's to your point, it's okay, get your ideal day, get your vision, take a step back, because we could always just keep grinding and grinding and grinding and keep going for the certifications. And we all have, the stories about the family pressures, the cultural pressures, the societal pressures. And what I valued from a lot of the topics that you have, and how you ground people in their core values and their why. And that can change with phases of life. And I think it's so important to have your resources, and then also to have someone that walks with you, such as a coach.
Yeah, I think stepping back to ensure being productive is aligning with your why. I'm going to step back a little bit and share an example of what happened to me when in 2018 during my fellowship in the morning. I would wake up in the morning, 5 o'clock, get things done, top three priorities done. And then my then fiance, well, then boyfriend actually would wake up later. And then usually he walks the dog around the lake or, in front of the apartment at the time. And every time, most of the time, when he asked me to go walk with him, I would like feel annoyed, impatient. I'm like, you're stopping my flow. I can't get my top three priorities done. And my why was, I want to spend time with the people I love. I want to, create residual income so I can, be with whoever I want for however long I want and take them to wherever I want. But what I was doing at the time was not aligning with it. I was focusing on what like reading some slides and reading a document when I was actually saying no to beautiful connection time in the morning. And I wasn't giving my best self to the person I love in the morning. And instead, I became impatient when he was stopping my productivity.
Mm-hmm.
So I think I realized that after reading The Miracle Morning, and I structured it to a non-negotiable that no matter if whatever I was working on, whenever he walks in the door, I will give him full attention. Or whenever he asks me to walk, then I will definitely walk. And all the time, every time we walk together, we have some connection time. We make some progress. We talk about various things. So and then plus, like when you come back from a walk, you're primed to be more productive in a way when you boost up your neurotransmitters. So that's one thing. In terms of the coaching, I talked about the beginning of it. It is focusing on the 5 goals. And then we figure out your Q1, Q2, Q3 goals. But in the end, there's a lot of tactics. It's very customized. It's one-on-one, 6-month program. And we customize every tactic, every strategy, and we have checkups like every quarter to ensure that you're taking steps to that. I'm the catalyst for you to achieve whatever your dreams are for that year, and then onto your dream when you're 90. So I guess that's a long and short of it. There's a lot of strategies. It really
Yeah.
depends on the person. It's body, it's mind, it's recovery, it's tech, etc.
Yeah, your story with your husband, or your now husband, or your boyfriend at the time, really resonates with something that happened to me in dental school. I was unable to cultivate relationships, and I was very focused on dental, even if I didn't even enjoy dental school. And it was, it's hard, right? It's just like you just have to put so much focus on, and then realizing, just like you said, taking that walk can have you zone in better. But one of the feedbacks I got that stuck with me today is that a boyfriend I was dating said, when you're with me, you're not with me. You're thinking about your schooling, you're thinking about this. And all he asked for me was something I wasn't able to stop myself and provide at the time. And I think work becomes an addiction. And, I'm reading The Myth of Normal by Dr. Gabor Mate. He talks about workaholism as like his response to trauma. And so something that you bring up is making sure we are identifying, are we being productive in alignment with what's meaningful to us, or are we busy? And what role does that busyness have in our life? So thank you so much for sharing that story with us.
Yeah. And I think the most important one of the tactics in order to combat that would be scheduling in the non-negotiables. So what that means is that the non-negotiable, like for example, for me, the non-negotiable is lifting 3 times a week, no matter what. It's become part of my identity. The non-negotiable is spending time in the morning with my baby, and then the afternoon putting him to bed, no matter what. And I do micro touch points like throughout the day. Non-negotiable is one type of self-recovery task, not task, but self-recovery method, like once a week or every bi-weekly, like float or massage, chiropractor, etc. So if once you schedule in those non-negotiables to ensure that your loved ones are taken care of and yourself is taken care of, then the work and the productive tasks will go around that instead, not the other way around. Not oh, if I have time, then I will like schedule some sort of recovery or a massage, like down the line. It will never happen.
That's great. Yeah, I was just at I was in a meeting where people were talking about scheduling time, and we could get into the mindset of we're going to schedule our time to be as productive as work as possible. And this was such valuable conversation here, because scheduling yourself first, your recovery time first, and what's most meaningful first. And you shared with me a little bit about the floating, and I heard you say it. Can you share what is the floating? It's something that I hadn't heard about before.
Yeah, it's my number one recovery method, actually. And so sensory deprivation float is or just float in general. You are in a pod and you're in so much Epsom salt that you're floating in there like the Dead Sea. And so once you close the pod door, it could not be a pod, it could just be like a tub that's enclosed essentially. You don't have any gravity stimulation. You don't have any sound. Initially, there's sound and light, but then it turns off. You don't have any sight, no smell, no taste. And because you have no more stimulation compared to the usually we're overstimulated by our phone, laptop, tech, notifications, and everything around us. Once all of that goes away, then your brain waves can actually drop down lower from beta, alpha, theta, maybe even delta into the sleep state. But it's in that theta state that you start having some insights and you start connecting the dots between one concept and the other concept. And the reason why this float is powerful for me because it can serve different purposes. I've gone in there to float and meditate after a sound bath, and we can talk about its sound healing. And I've seen myself or seen imageries of myself in a fetal form at 5 or 6 weeks old, and just felt tremendous compassion for my fetal self. I've fallen asleep. I've meditated a lot on forgiveness, lots of forgiveness, finding the gift. I've envisioned my future in a year, 3 years, or when I was, 80 or 90. I have also created a whole mind map of a productivity course for 8 weeks in my head in there. I've practiced lifting in there, weightlifting in there. It's just so many things that you can do when you're floating. The feeling you come out from floating, sometimes you'll need a few sessions, like 1, 2, or 3 sessions. But for me, the feeling that I had when I came out was the first few times was that uh, time did not matter. I didn't need to look at my phone. Everything just flowed. Like my whole my emotional state was just like this. And no matter what news came at me at that time, that I knew everything was going to be okay. Time almost like stood still, or time didn't matter. It was pretty crazy. So it just gets you into that deep parasympathetic state and gets you away from the fight or flight state.
Oh my gosh. It sounds zen. Sounds so peaceful.
It's there are different sessions. Some sessions are like super zen and it's hard for me to even get up. Some sessions are like, I'm energized, I'm ready to go, I'm ready to like write down notes and like remember everything like I ever planned in my head. So
Wow.
just depends.
Yeah. So let us know if you try floating out, because that is something I'm going to make sure I try. And then you said the sound healing. Can you explain more about that?
Yes, I was exposed to it when I was in California. Actually, my friend took me. I had never heard of it before, but there are various. It's basically a different setup, but usually you go into a room, lay on a mat, you have a blanket, a pillow, and you just lay there. And there's a practitioner in sound healing who performs a sound bath. And usually there are crystal bowls to various sizes, and there have other instruments too. And some people mix in actual music. And depending on the frequency of the music or the instrument, it can create various emotions in you. And very often, you can think about your inner childhood state. Start having childhood memories come up. So, uh, and I think the imageries it just depends on you. It depends on, what you're experiencing. Sometimes it could be healing. Sometimes people could be crying. But
Mm.
I think you just let the music take you. But it's hard for me to explain maybe I'll give an example what it did for me at least, because for everyone's a little different. I think for so a few weeks ago, and I don't know if we talked about this, maybe we did. For a few weeks ago, my baby choked on the fishbone, and we
We
took him
didn't
to
talk
the
about
ER.
it. No, I didn't hear.
Oh, okay.
Yikes.
Yeah. Cinco de Mayo. Yeah. Cinco de Mayo. My baby, I fed him some mackerel fillet, but I didn't pinch everything in there to make sure it was already pretty small, but I didn't pinch it all the way flat with my fingers. I just kind of looked through to make sure there are no bones. And essentially, he choked on the fish bone and he kept gagging like, "Eh, eh, eh." And then he had two bouts of bloody vomit in front of me, and I kept trying to, and I even used the life vac on him to life vac is a suction device with kind of like a mask over it. It's like a plunger that creates negative suction, and you can hopefully, it's for choking. Well, this is a fish bone in this case, and then you can hopefully dislodge it. Anyway, the gagging got maybe a little better, but he was still intermittently gagging and just like crying and gagging. Anyway, we took him to the ER. Lots of the pediatrician and the ER, they were going to do a CT scan on him, expose him to radiation. He wasn't drinking at the time. I had such a hard time deciding as a mom, versus like a physician, and as a physician, yeah, I would just get the CT. But as a mom, I was like, if I give him radiation, he has childhood tumor down the line over a fish bone, I would never forgive myself. But
Mm.
anyway, long story short, because they examined him pretty deeply with a tongue blade, he gagged and choked a bunch. And after that, because like surgery came to see him, ENT came to see him actually, and he stopped gagging. And we think that he worked its way down, the fishbone down, and he drank finally while we were waiting for the CT. But since then, I don't want to say mom guilt, because guilt basically means that you have the intention of hurting the person, so you feel guilty. I would say that I felt like sad, and why didn't I check the fishbone more? Was I being lazy? But actually, I wasn't being lazy. I was just because I know my baby doesn't like mushed up stuff, so I didn't want to mush it too much. But I blamed myself for being lazy, and just had a lot of sadness, or I couldn't forgive myself that whole weekend. Um, and even though I tried to forgive myself in my head, I talked myself through it, but I didn't feel it. I tried. I can feel that it wasn't fully there, but it was a process. So anyway, the next day, I happened to have this scheduled sound bath and float. And then within the 5 minutes of the sound bath starting, then I had imageries of Kai, my baby, forgiving me.
Oh,
So like he came up in his baby form and he told me that he forgave me, uh, as don't worry and just play with me. And then
wow.
so, and then there was like a lot after. I was in my childhood form myself. I was holding on to the hands of my husband in his childhood form, and then my baby. And then I think we all decided that we were just going to play, have fun, and not worry about being anything. And all I had to do was to be. There was really no, there was a question that kept coming during the sound bath, like, what is my purpose as my child form? What is my purpose asking my child form? And then my child form said, there's really no purpose. Like, you don't have to have a purpose in this world. Just like a lot of people are asking, what is your passion? What am I meant to do in this world? And then my child form said that, no, really, I don't have to have a purpose. I'm going to flow, go with the flow. Whatever I decide at that time point, I'm going to go for it. But if I decide I don't want to go down that path anymore, I'm going to switch time point. And then depending on the sound and the instruments, there were various, like, it's almost like various, like, bamboo sticks of multiple destinies that I could choose from. They were all above me, and all I had to do was pick. So that's a very long story short of what that sound bath was for me. It actually was a long story.
It was beautiful though, because you really painted that picture. And like, from my perspective, it's that wave of like, you're a mom doing her best. You're a mom doing her best. You were thinking of all the things like, my baby doesn't like squash up food. Like, that's a mom going above and beyond, knowing exactly what her baby likes. And you're a mom doing your best. And how many people will relate to these accidents that happen. And we think, well, what could I have done? And fortunately, your baby's fine. Right. And to have gone and had that healing modality, I'm so grateful that you shared it, because there will be people here that are holding on to something that really need to find, a new healing endeavor to really explore what could it be like to, receive forgiveness from your child, or even your childhood self. Yeah.
Yeah. Yeah.
That passion thing really resonates too, because I have I have friends that are multi-passionate, right? And I think it creates this anxiety within us if we don't allow ourselves to have an abundance mindset about, like, maybe I can have several different things I'm interested in that I'm passionate about, and our sense of purpose can, change. And then we don't have to judge ourselves for that, because we have the whole sunk cost fallacy where we hold on to things from the past because at one point that's what our identity was, and that was true for me. And to allow it to be fluid, then we don't hold on to that as much, and we can really open ourselves up to the possibilities.
Yeah, yeah, that was eye-opening for me when the imagery came. It was like literally I was just touching these like bamboo sticks above me. It was like a ceiling full of hanging bamboo sticks of destinies. And I was like, okay, maybe today I want that, or I could pick that, or maybe I can do that, or whatever. And it was just being playful. And then a little bit on your, compassion for yourself. And that's when I did the flow afterwards. And then within 5 minutes, I've never done a combo back to back. That was the first time. And then within 5 minutes of me being in the flow, that's when I had the imagery of being in the womb myself of my mom. And I was watching my 5, 6 week old and self, that's what I only guessed that because the heart was beating. So I guess it was at least like 5, 6 week old, but it was like a fetus.
Yeah. It's such
Like
a
super
physician
small.
talking, right? It's like physician and mom talking, right? It's like, oh my gosh, that's so funny. It's really funny. Yeah.
It was like, oh, it's not fully formed and nothing is fully formed. There's like some eyes, but yeah, there's a heartbeat. So, but it was like at the time, the imagery was, me viewing myself and just thinking to myself, to the fetal form, like, don't worry about what you did this past weekend, as a mom. Like nobody is going to, in your fetal form, nobody is going to blame you. People are going to give you unconditional love. You don't have to do anything or do well at things for you to receive all the love that you deserve. And it's hard for me to explain. But typically, when a baby is born, or if you see a beautiful tree or flower, they don't need to do anything or achieve anything or get any certificates or say the right things for you to give them their love, right? And compassion. It's with the society. Somehow we're brought up with these like micro traumas that we feel like we need to do this in order to deserve love, but we actually don't. So it was just very impactful for me at the float that I was actually able to recognize myself in my fetal form, and that it was okay this past weekend. It wasn't a right or a wrong, that it just happened, and I will move on and learn from it. And I'll look at every fish pieces and squeeze the hell out of it every time.
Yeah, you will. You will eat the squeezed food. It doesn't have fish bones in it this time, but yeah. That
Yeah.
resonates
Yeah.
too. Yeah, with everything you're saying. So when I sat with, I think a lot of us distract ourselves from sitting still because we can feel that pain and loneliness or the emptiness of what could come up as not feeling loved or unworthy. And so I was stuck in that trap of constantly seeking outside of myself something that would fill that void. But then in the silence, it feels more empty, right? Especially if we're navigating away from our true selves and our things that we might actually really enjoy in order to be who society tells us to be. And so that's when I would encourage, if people are hearing this and be like, wow, I am stuck in that trap. You have this opening, right? I find that all these healing things can open us to more of the awareness. And then how do you process through that when it comes up?
The which part exactly?
Yeah. So I'm thinking for me, when I was more aware of, like, when you're talking and like, the baby doesn't need to do anything. Like, I want to cry, right? Because then, like, for so long, we are fighting and we are clawing our way up, and we can often be in an oppressive society, and just like nothing I ever do is enough. But then, if we allow us to get into the state that you shared and are in that realization that I never had to do everything I thought I needed to do, and I am inherently worthy. Like, I had so much grief when I first experienced that thought, and to process through it was a lot to take in. So I was curious how it's impacted you and how you manage all the thoughts and the feelings that come up.
Yeah, yeah, absolutely. I think number one thing it will come back to. And, like, you'll realize it and then it comes back and then you want to do something to prove your self-worth and then you're like, no, I don't need to do anything. But then it comes back again. So it's like
Yeah.
it's never ending. I think my first experience with that was after 40 Years of Zen by Dave Asprey. So what it is, it's a 5-day very deep meditation where you're in a pod and you're hooked up to EEG and you have sound feedback to know if you're in alpha state, beta, etc., sometimes gamma. And so you're training yourself to be in sync, more synchronous, be in flow more. And then we did a lot of reset process or forgiveness process. So I went in thinking, okay, all I have to do in this world is to be present. I came out and my North Star was all I have to do was to be. And that was a huge mind shift. I think it was a relief for me almost. It felt like a weight off my shoulders. And every time I get back in the trap of I need to do this perfectly or I need to say um it allowed me to be authentic. Like, for example, sometimes before a podcast or before a speech or before a presentation, you're scared because you're afraid how people will view you.
Yeah.
But if you just allow yourself to be and know all you need to do is be authentic, it gave me the courage to say, I'm just going to be who I am. This is how I'm going to speak. Whatever I say was meant to be said. That's just how it is. I don't really care what people think of me. As long as one person hears that one thing that they resonate with, then that's fine. If not, that's fine too. So I think it gave me actually a lot of courage to be myself and not go through life thinking consider other people, of course, but putting myself first in a way and putting my family first and not go through life worrying about what other people think of you.
Yeah. And it's not sustainable. People know when you're not authentic. I felt that pain of loneliness, and I realized I had tried so hard to fit in and hide, like, I'm a really sensitive person. And now I've learned that it helps you connect with people and learn the strength of being sensitive and the vulnerabilities and how you protect your energy. But I think when I first got in the military, it was to hide the fact that I was like super sensitive. And then I was just like a super sensitive military surgical resident, right? Like, that didn't change, but it felt worse to try to hide core parts of who I was. And our society has, like, even talking about self-compassion, people resist that. And we think, I always encourage people, like, get to the core. I'm always a core, people don't always want to dive deep. I'm like, but get to the root of that, because it's more likely to show up over and over again if you're not really exploring where did this stem from. And a lot of the, like, the self-worth thing, I know where that stems from. Like, go to therapy. I was like, I know where that came from and how it's showing up in my life now. And I was picturing when you were having that moment of awareness that you were doing things that were out of alignment, what did the awareness look like for you?
So I'm thinking, well, I had a coach, I think was the first thing at 40 Years of Zen. Um, they were called a facilitator, but like a coach essentially. They listen to you when you go through your forgiveness process and they just probe and probe. And I was like, yeah, I've realized now I don't have to get my certificates. I don't need to do any more schooling. All I have to do is be present. And I was still putting something in there. And then so he was like, do you have to be anything really? Like, do you think that you need to be present for people to be to approve you and for you to deserve love? I was like, oh, I guess not. And he gave me the analogy of the baby and something beautiful, beautiful tree, beautiful flower. And that's what really got me to realize that no, we were all inherently, that baby back at one point in our lives. And it's still the same. We don't need to do anything in order to deserve love and compassion um, from others. The reason why you don't get it from other people that you want, like a lot of times, like our parents, the reason sometimes I think when you don't get it, it's because they have their own trauma that they're working through. And it's hard to break out of that cycle and to have the awareness. And if you don't have self-love for yourself, it's hard to have unconditional love to others.
Yeah, I think it's so powerful. And I think that, the multiple ways that we shared, I think it's worth that repeating because it's something that we think we have to keep grounding ourselves in, especially when you go back into the spaces where it's ubiquitous that you see the contrary, right? And especially in medicine and in academic environments and in our culture today, it's like we have to resist what's the cultural norm in order to actually lean into a life that could be deeply meaningful and fulfilling. Just
Yeah, and like you said, like once you become authentic, before this, before starting a podcast, I was really worried what others would think of me. How can you be a physician and start a podcast? And then, are you focused at your job or not? But I wasn't thinking that, you can, if you have the right productivity regimen and routine, that it is possible to have multiple things. You start one thing automated, start another thing automated, then you have several things going on. Um, but in my limited mindset, I was afraid and I wanted to hide and I didn't want people to know. But later on, I got over it just, partly from 40 years of Zen, put my voice out there. And now I'm in a tribe of, similar mindset physician, entrepreneurs, real estate investors, podcasters, what you name it. And then they're there and you find that your tribe will gravitate towards you and you actually belong somewhere.
Yep, that's the exact. So I love Brene Brown. I have a cup that says, "What would Brene Brown do?" And it's off camera, but you see it now.
Yeah.
She talks about the opposite of fitting in is belonging, and of course, the opposite of belonging is fitting in. And it's to your point: is when we mold ourselves and we're not who we are, we might fit in, but we won't feel like we belong if we are authentic. And that resonates with my journey. Is I was actually hiding in. I felt a lot of guilt and shame when I left surgery and I was medically discharged from the Air Force, which was so embarrassing for me, who championed myself and being like a very fit person. And I was so lost and I just had, my whole worth was deflated. And that's why I love speaking about the fact that that's the risk, right? If we put all of our self-worth in these external things, and our suicide rates are high, and that's part of my story. And I want people to make sure that they're grounded in their self-worth and they know they're loved, and we don't care about their CV because without that, I fear for the consequences. And I went 5 years feeling that way until finally I was like, I can't live like this anymore. And I wrote about my story, like everything I was most insecure about. I just wrote about it and put it on Kevin MD because I was like, whatever, if it saves one life, it's worth it. And it did so much more than that, right? I definitely probably saved at least my life figuratively in that it rejuvenated my soul, but it was very enlightening to how many people shared and resonated. And then I was like, I was no longer stuck in my own egocentric, and like, because we see our suffering and it feels like we're the only one. And when you realize like how much suffering is in the world and how connections can really cultivate that sense of belonging that makes life so meaningful. And I also think about like all the things we thought were supposed to bring life meaning bring us away, as you showcased in your stories. We all get so busy and it brings us away to the things that could really give us that sense of having a family. If it's not necessarily blood family, but having a place where you feel like you belong, and how much better that feels.
Yeah. Yeah. So it's like, as an example, because of work or, you're so busy that I don't know if you have, but I've said no to weddings. I've said no to bachelorettes. I've said no to friends get togethers. I've taken moonlighting shifts when people from out of state like came to visit me. I signed up for a shift. And so I didn't get to hang out with them the latter half of the night. Like all those things were, not focusing on what truly mattered, my values, which is like creating beautiful memories with people I love. So like I would say right now for your audience, whoever's listening to this is to really figure out what's important to you, what you value, and to really imagine, like sit down, close your eyes. It could just take a minute and imagine what you want your life to be like when you're 80 or 90 years old, depending on how old you are. And then just see, focus on the 5 goals for the year to get you there. And then out of the 5, really, if you have kids and a spouse, it should be you, your spouse, your kids, and really you should focus on 2 professional. Otherwise, everything else, you lose focus and you'll lose yourself in the busyness, and you'll tackle one thing after the other and actually not make progress in any of them.
Mm-hmm. Oh my gosh. This is definitely going to resonate with so many people. And I know when people find, we often wake up and people can be in that state of exhaustion and not be able to think clearly. And so I always recommend, like, if they're noticing, like, I just feel so out of alignment, the first thing I would recommend is to step out of that environment and like to pause before they start to evaluate, because they may not be able to think clearly. And so what would you recommend is when people say, you know what, I am so out of alignment? You were mentioning the goals, but do you have like, what's their next best step?
If you feel like you're stressed, out of alignment, a lot of times what I do when I have so many mounting things to do is if I already have my 5 goals, then I would do the Eisenhower matrix. So for those of you who have not heard of the Eisenhower matrix, it's 4 quadrants. And then you can look it up. It's easier if you Google it and actually see the quadrants. But left upper quadrant, it's urgent and important. I basically take down every one of my to-do lists and just put it on these quadrants. So urgent and important, it's like medical items, family emergencies, that would go there. Or any sort of, if you're working in the hospital, of course, depending on the patients, that would be urgent and important, depending on the emergency. And then top right is not urgent, but important. So those are the things that you should focus most of your energy on. And that's taking you towards your 5 goals and your values. So a lot of times it's, reading, for me, like reading some documents, doing some sort of recovery. It's not urgent, but it's important. Lifting, creating, looking at real estate deals, or, talking to my clients for productivity, actually doing my work at NASA, depending on what it is, lots of research, lots of document reading. So those are deep work, not urgent, but important. Left lower, that is urgent, but not important. And a lot of times people are asking you for things, requesting things with urgency, but they actually don't serve you. They don't help you towards your goals. And those I usually wait until the afternoon to do, just so you know. Not that I don't help people, but I will wait to serve others in the afternoon. In the morning, I usually serve myself and do my deep work. And then the right lower quadrant, then it is the not urgent, not important. So those are the things you should just eliminate. And a lot of those are, you know, if you have things, very important things that are looming and you're procrastinating and not doing, and instead you're watching Netflix, which is totally okay after you've done your top 3 priorities. But if you're procrastinating and delaying and you're flipping through Netflix on and on and on, that is a not urgent, not important. If you're responding to somebody on your social media, creating connections, that's okay. But if their top priorities are not done, like paying your bills or underwriting a property or, other sorts of connection, like paying attention to your baby when they're trying to, get your attention, but you're scrolling through your social media, then I would say that is not urgent and not important. So it depends on the context. When I'm overwhelmed, I put down every little thing, every task that I just brain dump, and I put them in quadrants. And then I just eliminate and I see what's in the right lower, just eliminate it. And I only focus on the top right, urgent and non-urgent and important. Very, very rarely do I have urgent and important items. And some people would say that the items with deadline at work is urgent and important. But I would say that if you scheduled it correctly and planned correctly, you would have already finished what you needed to do a week or a few days before the deadline. So I would say that is a practical way in order to de-stress yourself.
This came to mind. Some of the things you said, I got caught up. So a lot of times in roles I've had, and people will drop things on you last minute, and their sense of urgency, I used to drop everything I was doing, and I've had to constantly resist that because I'm now aware, but I haven't retrained myself consistently enough to stop doing that, because they said, I need this done. My deadline is at the end of the month. And it's very laborious on my end. Like, it's very time consuming. So it will go into the nights, into the weekends. And I was constantly doing that and really depressed. I was feeling undervalued. I was feeling like I had no life. And I could feel that friction of, I'm living out of alignment with my core values here, but the people pleasing, because a lot of my self-worth came from external approval. And I'm saying this because people relate, and this is why we need these things, right? And so I was like, is this truly urgent? And what would it look like to show up for myself? So if it's urgent for them, well, they should have, as you said, given me a lot more time to be able to do it, because it's disrespectful now of my time. And how do I feel worthy enough to claim that? Say, this is disrespectful of my time. I will get it done. And here's the time I need in order to get it done. If that time doesn't work for you, then I'm sorry, like, you'll need to find someone else to do it. Which you wouldn't want that to be put on someone else with that sense of urgency, but you're hoping that the statement is claiming that this isn't urgent. And if it was, it should have been delivered a lot earlier.
Yeah.
So
Yeah. It's like drawing boundaries, essentially. Like, how much are you going to let people cross your boundary? I used to do that, and now I'm like, nope, after this time, this is like baby family time. I'm not doing anything. I'm not looking at anything until the next time I'm looking at it. But I've also like focused enough, like I've been able to prioritize and focus enough to where, I just do one thing at a time. And I've gotten really good at not letting internal urges to check phones and check things or check notification. I've turned it all off. So I'm able to be like, no, I don't want to look at anything. I just like focus. So you get to that state where you can draw boundaries and you can finish things quickly.
And I didn't realize, after we met, one of my core things is that I check things constantly. And I've always been a checker of, before social media, like checking car locks, checking everything. And so that habit then persists in how I check. And emails used to get sent to me with a sense of urgency, but now I've realized that if it was emailed, it's not urgent, but I would check it because I didn't want it to fall through the cracks. And the behavior of, when I'm anxious, I check social media. And I realized that I was getting so overstimulated, and I stepped back. I'm like, but it's not my, like, if I were to isolate my job task, that's not where I'm being overstimulated. It's because I'm constantly grabbing at other things because I was so overwhelmed. And rather than take a step back and like structure what you just said and delegate my own time, I was allowing it to overwhelm me. And it was this ending the day with this constant fatigue, but yet feeling like you didn't fulfill your day's obligations, or you did, but yet you didn't have anything left in the tank. So
Yeah. Yeah.
yeah,
So
after
have you,
I would
uh-huh.
say after we met, I failed miserably. It took me like 3 days to commit to, I started reducing the notifications and then just had more awareness. I'm like, oh my gosh, this is so much harder. Like overwork becomes an addiction, social media checking becomes an addiction. And I think the best thing was I was aware of how much of a challenge I was having. And I was like, what role is this serving? And how can I claim my energy back by creating boundaries within my own actions, right?
Yeah, sometimes it's hard to have the discipline. So I think one thing I recommend people, this is regarding emails. One extension you can download is the Chrome extension. It's called Inbox When Ready. And it's amazing once you download it. If you have Gmail, when you log into your Gmail, the entire inbox is blank until you press show inbox. And a lot of times we're scared to go into our email because we know we're going to get derailed by whatever we see. And really, we just wanted to go in to respond to this one email or to draft the email to request something. So this allows you to do that in the morning. And so all you do is search for the email you need to respond to, or just compose and then close it. And you don't go back to your email. I mean, I don't go back to my email until the afternoon. I just batch my email response like 1 or 2 sessions, show inbox, and then that's it. So time it to like 30 minutes, an hour. I think, if you can download Inbox When Ready for the audience here, try it out. I've heard that it's one of the, for me too, that is one of the few uh, emotional or stress decreasing extension that they've had.
Yeah. So download it and let us know how it works for you. I'm really curious if people can start implementing. You shared so many amazing tidbits. And like me, I know the first time we try this, it's going to throw us for a loop, right? When we try to lean into the change. So I'm curious, how can they find you if they want to work with you?
Yeah, again, thank you for the opportunity. I know we dove into so many different topics, and I hope the audience has, gotten the first step or this resonated with you. And yeah, you can reach me on it's not rocketscienceshow.com, or you can go to productivitymd.com. You can book a 30-minute complimentary call with me. We can take a look at your situation in terms of productivity and let's tackle it. Let's get some real strategies down, and so that you can actually get things done so you can spend time with who you love. And anybody, you can always reach me on social media. ANNTSUNGMD on all the social media, Instagram, Facebook. But if you wanted to email me, it is tsungannmd@gmail.com. TSUNGANNMD@gmail.com. And whenever somebody emails me, that will definitely respond to you. So you can just send me an email and then we'll work to see how we can get your life to be even more productive. The goal is to get you 10 hours back in your week in just under an hour.
Oh my goodness. Well, thank you, Anne. This was such a deeply meaningful conversation, and I can't wait to hear feedback from when people are starting to implement these changes, because I think it's going to be huge in starting to get back into alignment with our core values and transformational. 10 hours, 10 hours. Oh my gosh. It's glorious. Thank you so much for being here.
Yeah, absolutely. Thank you so much, Jillian. And I am so happy and so grateful for our time together and grateful for the audience time as well. Thank you.